Welcome, everyone. I'm Gloria Salazar, interventional radiologist at University of North Carolina at Chapel Hill, and I'm here for the VLU Voices edition, interviewing Dr. Maureen Kohi. Dr. Maureen Kohi is a professor and chair of the radiology department at the University of North Carolina at Chapel Hill, and she's also a member of the board of the VIVA Foundation. And with that role, she's also in charge as a course director of the VIVA Veins. And today we're going to be hearing a little bit more about the 2023 edition of VIVA Veins today. Maureen, welcome.
Thank you so much for having me.
Thank you for being here. Let's get started with how you got involved with the VIVA Foundation and how did the collaboration between VIVA and the Veins meeting started.
Well, thank you for that. I had gone to VIVA as a junior faculty and mid-level faculty and really enjoyed the multidisciplinary format of the meeting. And during the paclitaxel controversy, I was asked to present at the Vascular Leaders Forum, the VLF, and in the past, I had presented my research at the VIVA meeting. The VLF was just such an incredible special opportunity to meet some of the board members and just the mission of VIVA, trying to spread as much education, cutting edge education about the field of vascular disease. I was very honored to be asked to join the board in 2020 and have been a member since. And I'm currently the chair of the Veins meeting. With respect to Veins, which stands for Venous Endovascular Interventional Strategies, so that's the VEINS of it. The Veins was a freestanding meeting, and it was born out of collaboration and in part, a great deal in part, because of Dr. Raghu Kalluri, and had been an independent standing venous meeting. The VIVA board, which was responsible for the VIVA meeting, which was predominantly arterial work, found that as the world of venous diseases and intervention was expanding, they wanted a partner to collaborate, and who better than Raghu Kalluri. So in 2015, he was approached, and the Veins meeting and VIVA came together, such that the Veins was the first 2 days of the meeting and overlapped slightly with the VIVA meeting, but it's sort of the beginning of this cutting edge multidisciplinary approach to vascular education. On the Veins side, it's exclusively on venous disease and intervention.
Well, that's wonderful, and certainly is one of the most prestigious meetings. As far as I know, when I was a fellow and all of us wanted to attend. And of course, the meeting has evolved and it had maintained its value and not only for the trainees, but I think also for the interventionalists. But in case somebody have not attended VIVA meetings yet, can you give us a reason for attending the VIVA meeting this year, particularly the Veins portion?
Oh, yes, absolutely. So as an attendee, you will have the ability to attend one or the other or both. I obviously would advocate attending both. The Veins meeting begins on the Saturday in the afternoon, so you can get in Friday night, enjoy Las Vegas, and it's also in Las Vegas, or sleep in on Saturday and start the afternoon with us at the Veins. The Veins meeting ends with a live patient evaluation on Monday afternoon. The VIVA meeting then picks up, and then everything ends by Thursday. Many reasons to attend besides the venue and the beautiful Wynn Hotel. The main reason, in my opinion, is the multidisciplinary format. You have giants of the field, whether they are interventional radiologists, interventional cardiologists, vascular surgeons, or vascular medicine specialists, who are there educating you the latest, greatest data, whether it's late breaking abstract sessions at the Veins meeting or at the VIVA meeting. Live patient cases from across the world are being presented at VIVA, and we have a live patient evaluation case at the Veins. At Veins, we have a blue sky session, which is 7 a.m. on Monday, bright and early, but that's when industry unfolds the latest and greatest that's coming down the pike. So kind of keeps us on our toes as to what the future holds in terms of venous disease and intervention. Lots of great networking sessions, industry sessions. There's something for everybody, whether you're a trainee, whether you're a junior faculty, mid-level faculty, you're a full professor, but you're trying to understand something in a different disease state. It's for you. And we have a lot of other collaborative meetings and sessions going on the side for our other healthcare professionals. And lastly, it's during Halloween in Las Vegas. So I always say that that's got to be on somebody's bucket list. It certainly is on mine. And you could just go ahead and experience it because it's a once in a lifetime opportunity.
That's wonderful. And I think if that is not enough reason for you to attend, just know that all of us learned with it. I have been attending Viva for a long time, and the discussions are amazing. And all the ideas that are generating from this meeting really lead us to a better care for our patients. So with the last question being specific to veins, this is going to be in October. There had been a lot of things happening this whole year and even previous years. What can we expect at Viva for discussions? What are the hot topics in venous disease that will be addressed at Viva?
Well, I think we're going to do a great job of reviewing just the bread and butter as it applies to superficial venous insufficiency and disease, deep venous interventions, PE, and a lot of the conversations and complications that surround those. I think hot topic right now is PE. There's a lot of clinical trials in the world of PE, NIH funded, industry funded, randomized, single arm. So that's going to be a great focus of discussion. Also the world of pelvic venous disease with a new clinical trial that's going to unfold soon in terms of it being a prospective randomized controlled trial. And then I would just say that we're going to have a lot of discussions as it applies to the usual suspects, whether it's superficial venous disease, deep venous disease, as well as just a lot of case-based discussions in a very relaxed conversation format. And I said in the prior question, the blue sky session, which is going to be the unfolding of the latest and greatest coming down the pike from our industry partners. So lots of great things.
No, that's very comprehensive. And I personally think that if you think you cannot attend a meeting at 7 a.m., yes, you can. It was packed last year. I was one of the moderators, and it was quite interesting to see different innovation and developments in the space, in the venous disease space. So here you have the course director, Dr. Maureen Kohi, telling you plenty of reasons for participating in this year's Viva meeting, and a combination of innovation, education, and collaborative multidisciplinary discussions to better take care of our patients. Thank you so much, Dr. Kohi, for your time, and I will see you in Las Vegas.
Thank you.
Bye.